Let's move on to our guests on the same issue. We are joined by Abhishek Dutt from the Congress Party, Saurabh Bharadwaj from the Aam Aadmi Party, Lalita Kumaramangalam from the BJP. But first, let me go across to Dr. Yatin Mehta. He's a chairperson for the Medanta Institute of Critical Care. Dr. Mehta, first up to you. What is the situation that you are seeing on the ground at the moment? What is the condition and the availability of beds and ICU beds, more importantly, at this point?
See, about a week, 10 days back, we were a bit relieved because the number of cases which were coming into our ICUs was coming down and which was consistent. But for the last 1 week or so, that has now abated. Now we are getting more patients from all over and many patients from Delhi, which we were not getting earlier. So this is a matter of concern because now Diwali is going to come. And when I travel from Gurgaon to Delhi, I see there is a significant difference. Delhi people, many people are roaming around without masks, and the speaker before me already said that people are being challaned who are in the cars or on motorbikes. But for whatever reason, people who are walking on the streets or in the markets are not being challaned. So I think this is a matter of serious concern. And now the schools opening and gyms opening and temples and mosques and gurdwaras opening. Why do we have to do all that when we were almost winning the battle? And now we are seeing the downslide again. I mean, there's something to really think about.
Right. Dr. Mehta, one of the studies have been that once the spread of the virus is a lot, the lethalness of the virus sort of goes less, right? So the amount of patients that you're getting at this point, are they more serious patients that you're getting? Or are you getting more of the milder patients at this point?
No, we are getting more serious patients because what happens, a lot of milder patients are already now reconciled to being treated at home. And the systems for treating them at home are better organized now. There is a supervision and then monitoring and pulse oximeters are available. So we are getting sicker patients from other hospitals and we are getting quite sick patients because they already get treated and then they get secondary infections and then coming to us. And we are seeing late complications also of COVID now, that fibrosis and long-term complications. So
for example?
It is, the lungs heal with fibrosis and then the lung function will go for a toss for a long time and many of them will not survive. So it's a serious issue now.
So you're saying not just the number of patients has increased, the number of serious patients has also gone up, which earlier was not what we were seeing.
Yeah, long-term complications now we are seeing of COVID, fibrosis particularly.
All right, and thank you for that, Dr. Mehta. Let me first go across to Saurabh Bharadwaj. This is a serious situation. What is the plan that Delhi government has in mind? Because a lot of us are baffled, Saurabh, at the fact that Delhi government is opening up even further at a time when the virus spread is at its peak. I can't emphasize enough, Delhi has not been in a worse condition since the onset of the pandemic.
Yes. Sonal, because you have a lot of viewers across India, and I'm sure, your viewers who are in Uttar Pradesh or Bihar or for that matter, any other state, I had, few Chhat Puja committees visiting me yesterday. A lot of people who have come back from Bihar and they were telling me, sir, यहाँ तो आप मास्क लगा रहे हैं, हमारे यहाँ बिहार में तो कोई मास्क है ही नहीं किसी के पास. सब market, all it's going like this. So basically, it's a concern for us as a society that people are not taking masks seriously. In Delhi, I think we are fortunate that we have a lot of media glare that people think about it, but still it can be improved in Delhi. But however, situation across India is worse in terms of people wearing masks, and obviously all different states are in their different waves. There are states like Delhi where it started.
But what's stopping Delhi from bringing in a law as well?
Hello?
Saurabh, what's stopping Delhi from bringing in a law like Rajasthan? What's stopping Arvind Kejriwal? He held a press conference today. He did not even mention the number of cases. Is this not on the top agenda of the Chief Minister?
No, I think the law is not needed. Even today, the police is challaning people for not wearing masks. You don't need to create a law for it. I don't know why the law was created, because there are provisions currently also available. But the problem is, which I agree to your reporter also, that the police is more interested in challaning people in cars, who basically belong to the same family. They are staying in the same room without mask, and when they are coming into the car,
I agree. That I agree.
Catch them for not wearing
Absolutely,
masks,
it's quite senseless at times. What Delhi police is also doing, chalaning people from the same family inside the car.
Roaming around in mandirs
But
and
in
all,
public spaces, Saurabh, what can the Delhi government do on public spaces?
Yes, I think we will press on Delhi police, because these powers are basically delegated to the police. They are the ones who enforce this. So we will, push it through Delhi police and also our, district magistrate offices, that, they should push such challans for people who are roaming around in the public places. Usually, police loves to, catch these low-hanging fruits, because these people are with the cars, so they will, sometimes pay for challans, sometimes they will pay you, underhand also. So, and it is causing a lot of traffic jams across the city. It is causing so much traffic jam because they have put barricades and they are letting one car pass, at a time, and it is causing traffic jams also, and it serves no purpose. 4 people from a family wearing masks in a car.
Chalaning a low-hanging fruit is something I actually agree with, but not with the rest of it. I'll let Abhishek Datta have a go at it. Abhishek?
What is more scary in Delhi at the moment is, if you look at the death rate, you're almost touching 1%. And air pollution along with coronavirus could be, and I think is the reason why the number of deaths in Delhi are going up. I saw an article today in the newspaper where they said that, social distancing from transportation from buses has been removed. My worrying factor is we have odd 3,600 buses in Delhi, and now to expect 50 people in a bus, I think, and further on the condition will get bad. My advice to Saurabh Bhardwaj through your channel would be, all these private schools are shut, their buses are just standing vacant. Why don't you hire their buses? Because the Delhi government in the last 6 years has not purchased any buses with the DTC. Hire their buses, follow the social distancing norm in the buses. And where Delhi is concerned, we are breathing sulfur and we are drinking ammonia. So we are actually going through a very, very tough and a difficult phase. And also my suggestion, because, we need to talk about Delhi as a whole. It's not about one political party.
And I hope Saurabh is listening into that. But my worry is more buses will mean more air pollution. It's a double whammy over here.
No, I don't think, Sonal, if you look at the figures, people are using two-wheelers because there are no buses and metro connection. If there is proper public transport, the pollution and the pollution levels will be controlled. And that is one thing we've been emphasizing to the Delhi government. And, these are the RTI that's filed in front of me. In the last 6 years, they've not even purchased a single bus in the DTC. They are running with the DTC flight of 3724 buses. We need 10,000 buses in Delhi. And my another suggestion to them is, the figures in Delhi where testing is concerned are very high. But the problem is we are doing 30,000 antigen tests and odd 12,000 RT-PCR.
Right.
In case you want to control this disease, RT-PCR should go beyond 12,000. Sure. It should reach to 20 and 30,000 at least. We can track more people. And also, we are not doing any tracing in Delhi. These are the issues. Mask is important.
I know Saurabh wants to respond to that, but I want to bring in Lalita Kumara Mangalam at this point. Ma'am, the point is, it's not just about Delhi alone. Look at states like UP. Look at states like Bihar. Pictures from there are scary. And in UP specifically, we know the testing has gone down significantly. They might not be reflecting in their numbers, but the situation continues to be equally bad there.
I don't know why we are talking about Bihar and UP when Delhi is amongst the worst states in the country. Now in Bihar, you would have seen the figures. They are far way ahead of, in terms of handling of the epidemic. The figures are far less, and they seem to have done a much better job.
But they're testing less, ma'am.
How people behave there. Please don't interrupt me. You never interrupted the other two speakers. Okay, give me the do me the courtesy of letting me finish, please. Secondly, the fact is that the usual old story of the AAP that you find fault to the center and the entire responsibility is shoved on somebody else's shoulders. You yourself said that the Chief Minister of the capital of this country did not even mention the fact that not only are the number of cases on the rise, the number of deaths have increased, and the severity of the infection in Delhi is obviously more, partially due to the terrible noxious pollution that we are facing year after year. This is the 6th year of Kejriwal being in power. What has he done to improve our environmental system, environmental situation in Delhi? Everybody knows that COVID comes in through the lungs and through our nose and ears and perhaps eyes. But there is obviously a sort of additional burden on children and on older people who are more vulnerable to the disease in the existence of this terrible pollution that Delhi has. And we are always only hearing excuses. Yes, people in India do not wear masks, don't follow social distancing, but the government knows that. And what is the point of putting the burden always on the people? So much money is spent on publicity by AAP. Could they not do a massive publicity campaign about this? They are popular in many areas of Delhi. People would listen to Kejriwal, but he's too busy doing self-publicity and claiming everything that he claims he's achieved.
Well,
people are dying in thousands. It doesn't matter whether they are rich, poor, etc., etc. If it's easy to shift blame, but it's very difficult to accept that we've made a mistake. And my last point, there is a severe shortage of beds in Delhi, even for VVIPs. I'm not saying VVIPs should get precedence. They should not. Everybody should be treated equally. But imagine if VVIPs don't get beds in Delhi, especially ICU beds, what is going to happen to the poor common man who's going to fall sick and come down with COVID?
Ma'am, I just want to point out that one, I gave you the longest time to speak on the panel compared to the other two, and I did interrupt the other two as well. So that out of the way, I just want to say that you have to answer the point on how come you're talking about not mentioning UP and Bihar, but the figures tell us that they're testing less. The figures tell us very clearly that they're testing less.
No, but there are figures that are coming out of even those who are falling sick there. And it whether it is, I don't know, maybe they have more, there is no scientific data actually that is still available on these sort of facts in India. But there are states where people obviously seem to be able to fight it better. I don't know, maybe environmental pollution is less there. Maybe, I have no idea. I'm not a doctor, I'm not a scientist.
Okay, I have to let Saurabh Bharadwaj come in at this point. Saurabh, please go ahead.
I'm amused by the fact that Delhi contains people from Bihar.
Ma'am, you have to let him speak, please. Ma'am, you have to let him speak, please.
Delhi has got people from Bihar. Delhi has got people from Uttar Pradesh. I don't think Delhi people have a special DNA, and people in Bihar and UP have a different, genetic structure that they are able to fight it more. I think the only things which the government can control and government can provide are these. One, number of tests per million per day. We are highest, not just in India, we are highest in the world. Delhi is highest in the world. Number of COVID care beds per million of a state, we are highest in the country. Number of hospital beds, we are highest in the country. These are the things which the government can provide. We are providing it, and it's a very simple philosophy. No test is no corona. Less test is less corona. Obviously, you cannot imagine that in Bihar, where there is nobody who's wearing masks, nobody is getting corona.
I get that.
Because
and what you're saying is backed by numbers as well. I get that. But Saurabh, at this point, this is an unprecedented condition. What is the government doing at the moment? As a resident of Delhi, I want to know what my chief minister is doing about the present condition.
Yes, you should be proud of the fact that Delhi is doing maximum tests per million per day, not just in India, across the world. And that is the best thing which is recommended by every scientist. More tests, more tracing, and you stop that chain.
No, Delhi is not doing enough tracing. I don't know about the testing, maybe yours is high, but contact tracing has not been done in Delhi at all. I know because a friend of mine fell sick, and I know that there was absolutely no.
You know everything. I think BJP knows everything.
Okay, let's not bicker here. Let's not bicker.
Being sarcastic is not going to solve the problem. And it's, by the way, it's not about DNA, it's about immunity.
Madam, you are so full of poison. So full of poison.
I'm not full of poison at all. You are the one who uses
it. Okay, we're digressing here. We're digressing. There's no point of this debate.
If you can't take being criticized,
1 second. Saurabh, 30 seconds to Lalita Kumaramangalam, please, and I'll come back. Ma'am, you were saying?
I said that, look, every opposition party has the right, and it's not only a right, it's our duty to criticize when we feel something is not being done right. If something is not being done right in Bihar, fine, I'm willing to answer questions. But it doesn't mean that I cannot ask people in Delhi the same questions. Now, in Delhi, I know for a fact, personally, that not enough beds are available. As Mr. Bharadwaj points out, we are in power. We get dozens of requests, dozens every week. And even people like me find it difficult to get beds for people who are really sick. And the number of
people like you? You are a VIP or what?
Has increased.
You are a
It
VIP.
doesn't matter what you think. And ma'am, why aren't you asking him to stop
You are a
interrupting
VIP
me?
or what? That even people
Okay.
like me.
Okay,
What do
if
you
both
mean
of
by
you
this?
talk like this, there's no point of the debate. I'm going to give Abhishek.
sorry
I'm
that
going to
he's
give
talking
Abhishek
like
some time to
becoming
speak.
so petty.
He's not
But
interrupted,
the
and he had
fact
some
is that
constructive
beds are
points
not
actually to say.
available in
Abhishek,
Delhi.
Abhishek, please, closing comments to you.
Sonal, I'm very surprised by the BJP spokesperson. You know, they have a very comfortable position in Delhi. When things improve, LG takes the charge. When things go bad, they start blaming. You know, this fight between Aam Aadmi Party and Bharatiya Janata Party, this blame game has to stop for Delhi. I fail to understand that the Delhi government can't buy buses. Why can't the LG intervene? I fail to understand the budget for controlling air pollution in Delhi by Delhi government is odd 52 crore rupees. And that money is earmarked for advertisement and publicity. You know, we need to give suggestions. We need to give solutions to Delhi. Let's add buses. Let's work on metro. Let's give proper infrastructure. Let's control the dust in Delhi by blaming Haryana for water, air pollution. Punjab.
Okay.
We are the people who are suffering. Delhi is dying every day. And my concern is the death rate is going up. And my suggestion to Saurabh is, I know your tests per millions are very high, but you're doing antigen tests where the accuracy is very, very poor. The day you say we are doing 50,000 tests, RT-PCR test in Delhi, go to the LG, take his support, increase the RT-PCR test in Delhi. That is where the solution is.
Okay. Dr. Mehta, I want to come to you. What is it that doctors, institutions need at this point? You have representatives from all political parties listening to you at the moment. What is it that is required?
See, we require politicians who put aside their differences, don't look at the narrow this thing of political spectrum, and try to solve this problem together.
Right.
We are all going to sink or swim together. Please put politics aside, work along with the medical fraternity who stood by you, and let us try to help these people. Whether they are from Bihar, it doesn't matter. They are in Delhi, and we have major problem in Delhi. Try to solve the problem together.
Doctor, how many patients would you say, or percentage of patients or ICU beds at the moment in Delhi are being occupied from people traveling from UP, Bihar, etc., where the facility is not that great?
See, I can only talk about myself. In Gurgaon, almost, I think, 80% of our patients are from outside.
All right. Okay.
Not from Delhi.
All right, that we leave it there. Thank you all for joining us.